Hi everyone, I am Camellia. I'm an APRN. I'm a psychiatric mental health nurse practitioner, a nurse enthusiast, and coach. And I know that I've done a few videos before. I've endeavored to sort of keep creating videos with content around the PMHNP role and some of the things to sort of look out for, to look for. Um, and I haven't been on here in a while. To be completely honest, I have started a new part-time position working in telehealth, and it's consumed quite a bit of my time. However, I just thought that I would pop on here between patients and talk a little bit about the one thing that sort of is lulling over a lot of students, those who are endeavoring to become nurse practitioners and to apply for schools. But I wanted to talk about preceptorships and sort of, some of the ins and outs around finding a preceptor if you are an NP student or if you're thinking about going to school to become a nurse practitioner, sort of the things to look out for, but also places to possibly find a preceptor and other kind of ins and outs about that. But first, it goes without saying, most of you know, even if you're not in a nurse practitioner role or if you're not a student, you know that there's this thing that's pretty universal where people that are in nurse practitioner school are having trouble finding preceptors. Okay, that goes without saying. It's been sort of that way for quite some time, unfortunately, and it can be pretty taxing for those that are, trying to pursue this route. They're trying to get done with their program, but there are limited people that they can follow for their clinical practice, which is the most important part of your education, in my opinion. But they're having trouble sort of completing that part of it. So there's many reasons why that exists, and I'll sort of break this down into a few different areas. But one, I talked about this in a blog that I wrote a while back, but some of it has to do with oversaturation. So we have all these online programs. We have programs that sort of are now being able to offer, nurse practitioner programs, and there's an oversaturation in a lot of areas. So with that said, there's not enough preceptors. And so for many reasons, people can't precept, they can't take more than one student. And specifically for the PMHNP role, you have to follow someone that is certified as a PMHNP. And so one of the things that I found is that in my local area here, there are practicing providers in psychiatry and mental health. However, some of them are FNP certified and not PMHNP. They're not PMHNPs. And so, of course, with good reason, the programs that are specific for psychiatry and mental health, they require you to follow a PMHNP or someone who has that certification. So oversaturation, not enough preceptors, and also, we'll say and be honest here that some of it has to do with the schools not planning properly and not really looking forward with supporting students in the most appropriate way around this. Now, there are lots of schools that are great out there that have gone before and been able to sort of look at preceptors in each area. They've been able to get a pretty good list of preceptors, but sometimes that falls through. And so, again, I think some of it has to do with the preparation of the schools. And then we also have COVID that kind of piled on top of all of that. So all of those things have been in existence for quite some time. But then COVID, of course, has limited some students from being able to actually step foot on a facility's campus or step foot in an office just for, limited traffic purposes with COVID. So there are lots of reasons that preceptors are not available. Nurse practitioner students are finding challenges securing a preceptor. But a few places that I wanted to kind of offer out, and most of you probably have pursued these if you are actively in this process. But one is just, mere networking. So networking with, the people that you work with, networking with some of the physicians and nurse practitioners that you may work with now if you are sort of at the bedside, or if you're a nurse and you're looking to go back to school. Just, networking with different colleagues will be important. LinkedIn is a good way to sort of get yourself out there as well. Even creating a profile as a student. I've seen that quite often, and I've gotten a lot of messages on LinkedIn about students looking for preceptorships. So that's a professional way to sort of set up a profile and to really be able to kind of look at all of the opportunities that you may have for people that are already practicing in the area that you want to work. Facebook and LinkedIn, they both actually have groups that are specific for example, nurse practitioners. I belong to a couple of groups, one on the LinkedIn page, as well as one on Facebook, where it's specific for PMHNPs. So you kind of adding into those groups as a student may offer you some support around finding a preceptor, because those are people that are typically already working in that role, or who may be in your area, and you can usually kind of look that way as well. The ANCC, I mentioned this before, but they have something called a Preceptor Bank, and it's quite handy. They just reopened it after some time, but that is also another good place that you may be able to secure a preceptor. And going to, the traditional cold calls, cold emails, I've gotten quite a few of those as well, with people just calling, or, calling the office or emailing. When I worked for a hospital organization, I got a lot of nurses that would email me through the hospital system email asking if I would be available to precept. When I completed my nurse practitioner program, there was lots of cold calling and cold emailing. I attended a program that they already had sort of a list of places to pursue in my area. However, a lot of those places were, by the time I got to the point that I was looking for clinicals, were no longer relevant. Some of the preceptors had moved on for different reasons. And so it was difficult to, really secure a preceptor. There are a couple more places that you can also look. There are two organizations specifically that I'm aware of that, one called NP Hub, the other called Preceptor Point. I've known a few people that have gone forward with those organizations as well. I think the drawback with those is that it does cost. There is a fee associated with that. In no way am I, promoting any of that, because I don't work for any of those companies at this point, but they are legitimate sources for finding preceptors in your area. So those may be some that you haven't explored if you are currently, in this position where you're looking for a preceptor. Maybe you're considering going back to school. The advice I would offer here is to start early. That goes without saying. Start before you apply to the programs. And more specifically, when you are applying to programs, check and see if the programs do have a list of preceptors already kind of laid out for you in your area. That's a good starting point. Again, in my experience, it didn't, pan out that I could use them because of different things going on. However, it's a good start. And it also helps you to understand if the program is well prepared to support you through that process. Also, I would say prepare to travel if you have to. I honestly, guys, the reason I'm making this video is because I got to a point that I was literally a few weeks away from having to suspend my program because of not having a secured preceptor. So it's really important. But I will say, be prepared to sort of do the extraordinary if you have to. One of my clinical rotations, I had to travel 1 hour away and 1 hour back to get those hours in. And another, I actually had to travel 2 hours. That was a short semester, but I definitely had to do it. I was committed to doing it, of course, so that I could get the hours, but it also was a very valuable experience because it offered me some real experience in an area that I had not been exposed to with pediatric and adolescent patients with psychiatry and mental health. But be prepared to sort of do the extraordinary if you have to. That also means paying, if you have to, and always have a plan B. So always, if you're planning out sort of your different semesters for what type of rotation you need to have, what type of experience, have a plan A and have a plan B. Because there are times where preceptors, change jobs, they get sick possibly, and they just, may be experiencing burnout at some point and they're no longer willing to take in students. Sometimes they may have too many students. And now that we're looking at, of course, what COVID is offering us now, we're more limited in that area with how many students you can take. So just have a plan B with whatever you decide to do or whichever route you decide to go. Be sure you have a plan B. And lastly, I know this video is a lot longer than I wanted it to be, but just a little bit of inspiration here. Worst case scenario, you may be delayed from graduating on time. You may not be able to get in your full, experience that you need to get to be on the course for graduation. But always remember, guys, that delayed is not denied. And so I had to sort of keep this in perspective, when I was going through this process, that it didn't mean that I wasn't going to graduate. It just meant that things may have been a little more delayed. Now, thankfully, that panned out well. So I'm hopeful that it will pan out well for you guys as well. Explore some of the things that I've talked about today. Message me if you have any questions. And I am, more than happy as always to talk with anyone who, may be going through this process. Maybe you're having a challenging time, with it. Maybe you're almost at the point of just not wanting to pursue things anymore. But don't let that be your hiccup or your hang up with pursuing your dreams and your goals, more specifically your passion, your purpose. And so I'm hopeful that this video has helped you in some way. Again, reach out if you guys have any questions, and I look forward to hearing from you. You guys have a good day.